today I'm going to be talking to you about big data and a bit about what it is without being too technical, and how it affects us and the progress we can make as a developing nation with it. So, what is big data? Well, let's start with data. Data is information. It means documents, or it meant documents, papers, and sometimes images, but now it means a whole lot more. Big data refers to huge amounts of information generated by the making of everything digital. So basically, it gets consolidated and analyzed using certain technologies. So we had the analog phones. Through digitalization, they became mobile and then smartphones. The humble typewriter moved into the computer and then the laptop, and gossip simply became WhatsApp. So digital information can be gathered in different ways. It's collected and in structured, unstructured, and semi-structured form. Structured data is easily categorized, and it's originally written. You can scan them, you can have them entered into spreadsheets, and you can store them in databases easily. For example, here at ABU, a lot of structured data is gathered every day from the students that attend, your name, your course, your department, and stuff like that, and they're all kept very easily. So unstructured data cannot be easily categorized, and they include photos and videos, and we have a whole abundance of all of that. Semi-structured data is data that can be identified, and you identify them using metadata, and these metadata are basically like hashtags, and a lot of us use hashtags nowadays, and basically this is how that information is identified and gathered. So basically, people tweeting and about different things, about using the same hashtags, you can use those hashtags to bring all of that information, even if you were talking about something completely different, but you put a hashtag in it. Whenever you put that hashtag in, it's all going to bring that data together, and then it's easily found. So this information, once it's digitally gathered, it's stored in data warehouses, and it's not like Dangote has warehouses. This is like virtual databases, and it's analyzed using algorithms. And these are like computations that big computers use to structure the data. One of the biggest advantages of big data has been predictive analysis. So, which is basically, based on what's happening now, we determine what could happen in the future. Big data analytic tools can predict outcomes very accurately. And for companies like Google and Amazon, who have been responsible for a lot of the major developments within big data, they've used it mainly for commercial purposes. So it's mainly about personalization of products and services. And when you buy things from Amazon, and this starts at the very first purchase, and it spreads over a period of time, when you sign in, the page will show you repeated information like repeat purchase or buy it again. There's headings, and then you have headings like related items that you viewed, or things that people who live in the same area like you or have share the same demographics have viewed, and it basically suggests things to you for you to buy. So sometimes you go in there, maybe you didn't like a product and you rated it very low. It will substitute a product for you the next time, or ask you whether you want to try something else. And based on this and ratings of other people, you get to be able to, your buying behavior is structured by that whole experience. So you might like this, here's a complimentary product, what you bought last time, etc. So you bought Gary, here's kuli kuli or groundnuts. So this is machine learning, and it's based on big data and on people's buying behavior, big data gathered from people's buying behavior. So this usually comes at the very end of the whole big data process. And big data is categorized by three things. There's variety, there's velocity, and there's volume of data gathered. And that is what basically, the more you give the computer, the more it has to feed on, and the more it has to be able to compute and give you finer and finer details and patterns of behavior. So the analysis is based on algorithms, which are basically sets of instruction to perform computation. So the more you feed it with information collected at the point of engagement or interaction, the finer it generates the patterns of recognitions through analysis. This is a form of artificial intelligence, and this is really our future. So now let's look at the non-commercial use of big data by governments such like Nigeria for healthcare, which is what I'm actually interested in, and this is what I do, and the kinds of progress that we can achieve with it. So, the use and application of big data analytics in healthcare can only generate positive and also life-saving results. When applied to healthcare and with the use of specific health data of a population, this can potentially prevent epidemics, cure disease, and cut down the cost of treatment. Health Map is an example, and it's a freely accessible tool. It's an automated electronic information system for monitoring, organizing, and visualizing data. And the data is on disease and disease outbreaks, and based on geography and time and infectious disease carriers. Health Map can basically show you where disease starts, how it spread, and what is going on everywhere, so it's tracked. Notably, the World Health Organization, the US Centers for Disease and Control and Prevention, and the European one, they all use Health Map. I don't know if the Nigerian public health sector uses it, but almost everybody does. So it is used as an early detection warning system, and it's also a situational awareness tool. So for healthcare, data analytics prevention is better than cure, and being able to draw a holistic picture of the patient will allow doctors provide the best care for them, and also preventative care with better outcomes for all of society. For Nigeria, I believe that this will start with a national electronic patient management system. An electronic patient management system is software for use by healthcare providers. It basically provides details on the patient, the demographics, area, things particular to the patient, and basically it helps map out the whole health map of Nigeria in that way. So it takes into account patient interactions with the healthcare providers or the administrative staff or anybody that is within that whole healthcare spectrum. It basically helps you keep data on that. Let's face it, everyone at one time is going to visit the doctor. So when you go to see the doctor, you don't want that to be the death of you. You want the doctor to have all of your information to hand and be able to give you the best diagnosis possible. So sometimes you go to the doctor here and you have to buy a card. When you go in, if you do have a card and it's the hospital system that has failed and your card can't be tracked, it means that you're starting all over again. And as you're starting all over again, there's data that's missing. So that means it's very possible that the doctor's going to see you and not realize that last week you went to a different clinic and had something else done. And when they prescribe something for you, you might actually be getting into trouble, taking medication on top of medication and stuff like that. So there's a lot we need to do about keeping data. You want all your data to be to hand so the clinician can have as much relevant information to treat you. You want historical data, people of your age group, your particular sex, shared symptoms and shared habits and types of treatments, types of medication use and successes and failures and outcomes to help inform the doctor's decision. All of this is computed through big data, clear information to help your doctor diagnose you and know how best to treat you. So with every visit with an electronic patient management system, your doctor has information to hand that is captured, and it subsequently helps bring everything to the point where they know you, they know the stuff that could go wrong with you, and when something goes wrong with you, they know what it might be, and then if it's not any of those things, they know it's something new, and it's going to, it's going to have history backing it up. So this is what we call evidence-based treatment. Treatment that has information, and not just your information, there's information of people like you, whether they're the same ethnicity, the same race, all over the world, informing that decision, and that is really best practice. We currently haven't got a national patient management system in Nigeria, and one that is uniform. Even if some clinics have and some hospitals do, it is not uniform. So the kinds of data that they're gathering are not the same, and the kinds of data that they're using, sometimes the data is not necessary. When you go to a doctor and you give your name, your sex, and age and stuff, asking you for things that they're not going to use, like in the UK, we have laws. You're not supposed to ask people for things that you don't need, information that you don't need, so we have to have that kind of beginning. So, we currently haven't got accurate record keeping and information in Nigeria as well. And this is also another way we can promote patient healthcare and safety. All private and public healthcare providers must come on board and partner together under the federal government of Nigeria and adopt a nationwide system that can help ensure the success of big data being gathered. We have many capable collaborators to deliver such a Nigeria-specific tailored patient management system. And if this is done well, it can form the spine for everything. And when I say the spine, everybody knows that without the spine, the whole body cannot function. It is a central system. Data is gathered. We have data on people, and that should help everything that the government does going forward. So we can have things like better census numbers. When the census is done and we're saying we have X amount of people in Nigeria, those numbers will be a bit more accurate. We can plan for education. We can know when there's a higher birth rate, and then we know extra facilities need to go to the area where those kinds of things are happening. So the government is, being informed and is working to a set target. With registrations of patients in the country and with each subsequent contact with healthcare, the information should be updated and capture any significant changes. That information should be regularly synchronized with the patient health records in a timely manner, and this will positively impact the reliability of data in Nigeria. In developed countries, people are living longer. And so treatment modes have changed, with many of these changes driven by data. It is proven that early treatment of any disease is far more easier and less expensive than treatment of it when the disease is full-blown. In the UK, within the NHS, a system called Open Exeter has huge amounts of data that it keeps. And this data is held on a National Health Application and Infrastructure Service database. So there's data on cervical screening, there's breast screening, organ donor, blood donor, home oxygen, bowel cancer, and there's other things, because all the general practices, these are the doctors, the local doctors, all their information for payments, for things they do with that is also kept on this system. So I've personally worked on cervical screening, and I remember one amazing thing is if you enter data in, and let's say a woman has come for a test and the test has come back with any slight change, the way the system gets triggered, and the woman, you will have your test maybe every 6 months, depending. If you've had a positive result before, you'll have 6 months or 3 months. But if you've had nothing, a year or 2 years sometimes. But once something, you enter data in that triggers something, it's like a domino effect. And that woman gets called in immediately, and that is looked into much deeper. So every year in the UK, 2,600 women will be diagnosed with cervical cancer. And of that, 700 will die from it. This data shows how much improvement is needed and gives a clear target. It is very effective, and it relies on big data successfully, and it continuously is an improving process. So imagine with the kind of that kind of data, if we had that and we could say in Nigeria specific numbers, and we can say, this is our projection and this is what we expect, and we can have that accuracy, then we know that what we're doing, the kinds of things that we'll be doing are more targeted and more, going to have a better effect. So, in developed countries, doctors want to also understand how much they can about a patient and detect warning signs of serious illness before they arise. Big data in healthcare is enabling this, and in Nigeria, we haven't even begun to scratch the surface of that. Coupled with an electronic patient management system, over time, big data can help generate intervals where patients identified as being under risk are invited earlier than they should be, and then the disease is monitored. Not only this, huge swathes of the population will be able to, understand whether they're susceptible to this based on the kind of data that the system is being fed. So before something occurs, the government can plan adequately for it and then have people in place to be able to tackle it. This kind of affirmative action can further be supported through the integration of different sets of data. So we have data for healthcare, there's environmental data, there's other kinds of data, maybe geographic movement. The movement of people can also be a carrier for disease because people get infected and they move from one place to the other. If you guys remember the Ebola crisis in Africa, we were just so lucky that public health and everybody stepped in. They were able to know where the people landed, who were on the flight, who were possibly infected, and everything was really handled very quickly. So healthcare in many countries is a flourishing sector of the economy. It is clear that we have insufficient and inadequate infrastructure to maintain healthcare in many African countries, including Nigeria. In the US, the application of big data mining can save $450 million each year. Sorry, that's $450 billion each year. And this is a healthcare system that already has a huge amount of money being pumped into it, specifically around $3.2 trillion. And this was between 2010 and 2015. And this was a 123% increase. In Nigeria, 3.9% of the budget is what it came to in 2018, which is around 340 billion naira. Compared to that, that's nothing. If big data can help America save money, then we had better get on that wagon, because the African Union's Abuja Declaration has recommended that at least 15% of the budget go to health, and that's not even happening. So if we're not going to be getting more money, then we better start saving some. Forget not meeting the World Health Organization's SDGs. With big data, we're going to sail through them because we know exactly what we're supposed to be doing, and then it gets easier to do exactly that. So how can big data help us? One of the reasons for the poor state of healthcare in Nigeria can be pinned on poor accountability of public office holders, corruption, inadequate spending on healthcare, and improper planning for the healthcare as well. So data is factual, and once our data becomes more reliable, it will become difficult and harder to manipulate information, basically. Planning will become more effective and cost-effective. The opportunities for this are endless, We can begin to predict and plan adequately to improve operational efficiency, from increased patient visits to the busiest clinic times. There's something that happens where I live in the UK. The seasons come, and we know the illnesses that come along with it. From that time, we start to stockpile more medication because we know that the numbers of patients coming in are going to go higher. In Nigeria, I don't think that is done. We're not doing things like preparing for eventualities we know that are going to happen. People are getting sick, and people are dying, and needlessly so, because if this data was to hand, then all the planning and preparation can be done, and all of this arrested beforehand. We can also reduce and eliminate fraud with a patient system and big data, because when we have the National Health Insurance Scheme in Nigeria, and when it becomes successful, and I have no doubt that it will become that, it can be integrated within this patient management system, and it will cut down a lot of red tape, because what it does is the whole system does everything. If it's like one of the ones we're proposing and I work with, it will basically get everything out of the way, and there's no need for things to come through the back door. So with big data, you will not be restricted by local boundaries. Doctors will be able to, you'll be able to be in Zaria and have your doctor in the US and be able to, he'll have your information to hand, and he can diagnose, and then you can be treated locally. So no more questionnaire surveys, no more, going around and trying to look for data as students here. You'll have all that data to hand, and basically what you'll be working with is reliable and factual data, and that means you will actually, at the end of your thesis, be proposing things that are really helpful and actually going to be very impactful. It basically means that one of you here is definitely going to find the cure to one of the diseases that is, plaguing the world today. And that is just imagining it with the wealth of all of that it could come from one of you without having to be going up and down trying to get data. Sometimes I know I've been here trying to get people to answer my questionnaires, trying to look for quality information. Big data is going to help solve all of that. So data collection in the old way is actually quite expensive and time-consuming. So every time a patient appears in the hospital, there's no need to keep getting people to fill out cards and everything. The national span will have that information, and all you have to do is download it to your system. The evolution of mobile technology, such as mobile phones, opens up a new dimension for all of this. Imagine walking around with all your medical data on, your phone, your iPhone, feeding information to an app feeding information to your doctor's surgery or the local hospital, and all of that data doesn't need to be gathered all over again. You know the sound of your car, and when it changes its sound, you know you need to take it to the mechanic. So big data over time is how your wearables, all your tech wearables, are going to feed into a system that will be listening out for the rhythm of your health. And before it happens, your doctor is going to invite you in and say, you need to come and see me. And guess what? When you get there, he's going to know exactly whether you're the original item or you're Belgium. And if he doesn't know where to get your spare parts from, then you're finished. According to Statista, a leading internet statistics database, we have about 170 million mobile phones subscriptions in Nigeria. Currently, only 10 to 20% of that are smartphones. But the number of smartphone users are set to grow by 140 million by 2025. So that means that we're standing on the cusp of a huge amount of information. When you think about it, the 90% of the world's data was gathered from 2011 to 2013. That's 90% of the data we have today. So imagine where Nigeria sits in all of this and the kind of information that we're going to be gathering and how we can use that to make our lives better. Mobile technology has a big part to play in the digitalization of healthcare in Nigeria and the capturing of big data. So when you look at it, we have big data. Hopefully I've demystified it for you, and I've touched on how a bit it's collected and analyzed. And I've suggested an electronic patient management system for Nigeria, and it has to be supported by mobile technology because we have all of the problems, challenges with electricity and everything. And I've also suggested that we initiate under the federal government a partnership for private institutions, because mostly Nigerians pay out of pocket for their healthcare. So the private and the public healthcare providers have to come on board. And of course, I've not talked about security, but we don't need to worry about that yet. We need to first get on that bandwagon because data security can always be tackled. And as we go along, protocols and softwares and legislation, of course, can protect. Finally, let me leave you with these words from Malcolm X, who said, "The future belongs to those who prepare for it today." So our time is now. Thank you very much.